Cavernous sinus infection is one of the risk factors to cavernous sinus thrombosis. So for this video, I'm going to discuss the characteristic features of the cavernous sinus thrombosis and then explain why cavernous sinus is at increased risk of infection. Now, in order to understand why there is an increased risk of infection, first I would like to review some basic anatomy, after which the understanding of the topic would be easier. So here we have the venous sinuses, which are the venous channels that are found in between the layers of the dural matter inside the brain. And the function of these venous sinuses is to drain blood from the internal and external veins of the brain. In addition, these venous sinuses receive cerebrospinal fluids from the subarachnoid granulations, which drain into superior sagittal sinus. And then all of these fluids will enter the systemic circulation via the internal jugular vein. So here you can see that the cavernous sinus is right at the center. And in fact, the cavernous sinus is the most frequent dural sinus to become infected, and the reason for that is that the cavernous sinus is anatomically located lateral to the sphenoid air sinuses. So here is lateral, and then on the center we have medial, and here we have the pituitary gland. And then a mirror image of these sinuses exists on the other side. Now, the fact that the sphenoid air sinuses has a lot of trabecula, what happens is that there would be bacteria that would be trapped, and therefore there would be increased risk of infection of the cavernous sinus. Now, cavernous sinus itself receives blood from the facial veins. So therefore, if there is an infection of, for instance, the orbit or tonsils or palate, they would all transfer into the cavernous sinus and cause infection of the cavernous sinus. And then infection of cavernous sinus is one of the risk factors to the development of the cavernous sinus thrombosis. And so the clinical features of cavernous sinus thrombosis is all related to the nerves that are being involved. So here you can see that we have the cranial nerve 3 or oculomotor, trochlear, ophthalmic division of the trigeminal nerve, abducens, as well as the maxillary division of the trigeminal nerve. All of them are located here. So if you have thrombosis of the cavernous sinus, there could be different phenotypes depending on the nerves that are being affected. Now, in order to know which nerves are here, I have provided you with a memory aid called OTOM-CAT. So OTOM is for the lateral nerves. So these four nerves that are lateral. So let's review them. OTOM. So oculomotor, trochlear, ophthalmic, as well as maxillary are OTOM. All of them are lateral. And then CA, ignore the T, is the medial one. So we have the carotid artery, and then A is standing for abducens. So carotid artery and abducens. So let's review that again. OTOM-CAT. So lateral ones, we have the oculomotor, trochlear, the ophthalmic branch of the trigeminal, and then the maxillary branch of the trigeminal. And then medially we have the carotid artery, and then we have the abducens nerve. Now, the symptoms of the cavernous sinus thrombosis, as I just discussed, is dependent on the nerves that are being affected. So therefore there would be orbital pain, proptosis, as well as ophthalmoplagia, and this is paralysis of the extraocular muscles. So you know the extraocular muscles are being innervated by cranial nerves 3, 4, and 6. So cranial nerve 3 or oculomotor, cranial nerve 4 or trochlear, and cranial nerve 6 or abducens. So do you recall which muscles are being innervated by every one of these cranial nerves? And the memory aid that I have for you is L6SO4. So you know how with chemistry we have this chemical formula for H2SO4. So here I have a new chemical formula for you called L6SO4. So cranial nerve 6 is innervating L, lateral rectus, while cranial nerve 4 is innervating SO, or superior oblique. And thus cranial nerve 3 is now innervating every other muscle. So once again, lateral rectus is by cranial nerve 6, superior oblique is by cranial nerve 4, and then the rest of these muscles are all by cranial nerve 3. So therefore, given that all of these nerves, oculomotor, trochlear, and abducens, all of these nerves are being affected by the cavernous sinus thrombosis, therefore patients can develop ophthalmoplagia or paralysis of the extraocular muscles. In addition, there could be loss of sensation in the corneal and maxillary areas, and that is due to the involvement of the ophthalmic branch of the trigeminal nerve as well as the maxillary branch of the trigeminal nerve. So here, let me show that to you again. So here we had the ophthalmic branch as well as the maxillary branch. Alright, now one other important point that you should know is that mucormycosis is another common cause of the cavernous sinus thrombosis. So this condition is caused by infection with the fungi Mucor as well as Rhizopus. And these fungi are generally abundant in decaying vegetations as well as in soil, and they would release spores into the air. So every day we are all exposed to these fungi, but our immune system will be not allowing these fungi to colonize our body. In patients that are immunocompromised, however, so immunocompromised, like for instance in transplant patients, in patients with diabetic ketoacidosis, which is more commonly seen in diabetes mellitus type 1, and then in leukemic patients, these patients are at increased risk of mucormycosis due to the weakened immune defense. So keep in mind, immunocompromised, DKA, very important, as well as leukemic patients are at increased risk of mucormycosis. And so the spores would be now able to colonize the paranasal sinuses, and then from there on they would spread to the cavernous sinus. Now, as for the clinical features, it's important for you to know that these patients present with black, necrotic eschar, in addition to diplopia due to the cavernous sinus thrombosis and the involvement of the extraocular muscles. So here is the example of the black necrotic eschar that you see in patients that have mucormycosis. As for the diagnosis, you will have to identify the organisms by the tissue histopathology, where you will see a hyphae at 90-degree angles. And then for the treatment of these patients, you will have to treat it aggressively by surgical debridement and antibiotic treatment with the amphotericin B. And that concludes our discussion of the cavernous sinus thrombosis and the rhinocerebral mucormycosis.